So we're going to proceed now with the last part of multidisciplinary healthcare team. So we're going to talk about practical tips that are supposed to be practiced even in a multidisciplinary healthcare tip. So the first thing, one of the practical tips that has to be done is how to apply teamwork principles. So this is one thing that we're supposed to talk about. Apart from this, we also need to get to talk about practical strategic approach. So I can just hope we are able to see in my writing. And then we can also talk about practical tips for healthcare professions. Okay. And then, so let's get started. What are some of the practical tips, the things that we need to practice in multidisciplinary healthcare teams? So the first thing is how to apply teamwork principles. So here are some of the tips to help healthcare teams to head towards success, achievement. So some things that have to be done in applying so that there will be achievement include a life example of a strategic plan. And then the second thing is practical tips for healthcare teamworks. That is what we're going to talk about on this stage. And then monitoring progress through patients' satisfaction. So monitoring progress through patient satisfaction. Remember, all we are talking about here are the tips, what we need to do to make sure that this is an effective team. So the first thing is we need to look at a live example of strategic plan. Also monitoring progress through patient satisfaction. Are you progressing as a team? Are you going forward as a team? And how do you tell whether you are progressing or not? You are going to look at the satisfaction of the patients. Are they getting satisfied with your deliveries, with your services? So those are some of the things that you get to look at. Now let's first start with looking at the practical strategic approach. Practical strategic approach. That is the second part here. So just on the practical strategic approach, the context for healthcare and support is changing most significantly. With people living longer, we have a greater number of older patients and people to support. So many with multiple and complex needs and with higher expectation of what healthcare and support can and should deliver. So there are a lot of patients who have got a lot of higher expectations of what healthcare deliverers should be able to deliver. So we need to get to pay attention there. So that is why this is practical strategic approach. This is practical. This is what we need to get to do because there are a lot of expectations. So delivering health and care support and services involves us working with people in a new partnership, offering and engaging with people in making choices about their health and care, and supporting no decision about me without me. So we need to support the statement no decision about me without me. So as we get to work with patients, we need to make sure that we have got that approach to be able to involve people and not just getting to work alone. And also get to support this statement, no decision about me without me. Imagine you want to perform a surgery on this person, and what you think is it is better for them. Well, don't do it if they don't know about it. So that is why we need to get to support. No decision about me without me. This is simply telling us that there's need for cooperation, there's need for people to get to know about their affairs. So there are statements made by the senior nurses, midwifery staff, and other health related professions also in the UK who have engaged a wide range of professions and the patient in assessing satisfaction and suggestions of these team members in quality of delivered care. So there are a lot of professions and also the patients and the thing that they get to use to assess whether there is proper delivery of service. So that is, we are using a practical strategic approach. So there are some of the things that have to be looked at to make sure that there is of course something that is being done, there is something that is happening. This approach that we are using is getting to succeed. So accordingly, they put a strategy to meet the rapidly progressing demand on the service. The purpose of the engagement was twofold. So we are talking about the midwife staff, the nurses, and also the health related profession in the UK. There are some things that they had to put in the United Kingdom. So as an example, that is what we are using. So the purpose of the engagement of the patients and just other people to make sure that there is strategic approach and practical approach in delivering services had twofold, meaning it had two sides. So firstly, there was need to get a wider view on 6 C's. So as you get to use the strategic approach to make sure that there is proper health delivery, there was need to get a wide view on the 6 C's to make sure that health delivery is made. So now what are the 6 C's? So the first one, that is care. The second one, that is compassion. And the third one, that is competences. The fourth one, communication. And then courage. And then commitment. Okay, so these are the 6 C's. So this team which came up, which was made up of the nurses, midwifery people, and also just other staff, the purpose was to make sure that they get to find out a lot of information about the meaning of these 6 C's, and they wanted to test whether these would resonate with the staff and patients and form a common language or their vision. So are you able to come together having one thing in mind, the patients and also the health staff? The aim here is practical tips. You want to make sure that you get to practice teamwork. So it is not just operating within just the health practitioners, also get to involve patients. And so on these 6 C's, they wanted to test whether these would resonate with staff and patients. And secondly, they wanted to test also their responses to 6 areas of action that underpinned by the 6 C's. So what is the response to these 6 C's that we have? Are people responding? Is there care? Is there compassion? Competences? Are people able to work really with competence? Are people able to work with that much courage, with that much strength, knowing that this is their job to do? Is there proper communication between the healthcare practitioners and also the patients? Is there courage to do what is necessary to be done? And are people also committed in working? So this team which was made in the UK, that is made of midwiferys and nurses and just health staff, they wanted to find more about this information. And is it really, are people really doing this? Are people really following this? So the strategy addressed equality issues under Equity Equality Act 2010. So this strategy that these health professionals got to use when they came together was to make sure that they got to address some health issues. Okay. Now, the 6 areas of action that we are supposed to deliver their vision included: Action Area 1, helping people to stay independent. So let's get to see about this. So we are saying the 6 areas of action that we are supposed to deliver their vision. So the vision of this plan, which was made by health practitioners, included some of the visions, having action area 1 that talked about helping people to stay independent. Apart from staying independent, also maximize well-being. So maximize the well-being of people and also improve health outcomes. So there was also the action area 2, which was saying working with people to provide a positive experience of care. So there was need of working with people. And why working with people? To provide an experience of healthcare. And then there was also action area 3, which was saying delivering high quality care and measuring the impact. So that is delivering high quality health care. Remember, action area 2 is just working with people. Now action area 3 is now to deliver. Action area 1, make sure that we improve and maximize the well-being of people. So there was also action area 4, building and strengthening leadership. So apart from that, there was action area 5 and also action area 6. So action area 5, ensuring we have the right staff with the right skills in the right place. So just right staff, right skill, and right place instead of being led by wrong people. And then action area 6, supporting positive staff experience. So this has to do with supporting positive staff experience. Okay. So some of the practical tips for healthcare professionals: always introduce yourself to the team. Clarify your role. Use objectives, not subjective language. So use objective language, not subjective language. Not as if you are trying to more like get controlled or controlling. So objective, you need to more put people there and as you get to speak, not taking anyone to be less superior. Also learn and use people's names. Be attentive when required. Read back or close the communication loop. State the obvious to avoid assumptions. Don't be assumptuous. Make sure that you state what is true. Also, ask questions, check and clarify. These are some practical tips for healthcare care professionals. Also, delegate tasks to specific people, not to the air. There's need to give people what to do. If something doesn't make sense, find out the other person's perspective. Always do a team briefing before starting a team activity. When in conflict, concentrate on what is right for the patient, not who is right or wrong. And remember, teamwork doesn't just happen. It requires an understanding of the characteristics of successive team and also knowledge of how teams function. So these are some of the important things that have to be known. And also Inform the patient daily what their plan is for the day and set expectations. Inform the patient and family if they have any question, concerns to call. Encourage the patient to communicate. So these are some of the practical tips for healthcare practitioners. And also now, when it comes to patient satisfaction, let's get to talk about that as we get to conclude in this tutorial. So patient satisfaction, a sensitive indicator for successful health delivery teamwork is patient satisfaction. So if you want to see that your team is doing it, your team is winning, there is need to see that there is patient satisfaction. Are patients satisfied with your services? So in here you look at what is called CPR. So this CPR stands for, the C is going to stand for compassionate communication. And then the P here stands for patient information or patient management. I mean pain management. And then we have got now the R, which is response. So to make sure that you see if you are succeeding as a team, you are going to look at the compassionate communication. Are you communicating with patients compassionately? Are you able to do that? And you look at the P, patient information. Is there pain? Sorry, this is not even management. I've written something. Okay, this is true. This is just all right. Pain management. So, is there pain management on the patient? So, when the patient is feeling ill, there management of pain? That is what is going to determine whether the patient is going to be satisfied or not. And then, what is the response on the patient from the patient? So, this is very, very important. So, in conclusion, the ambition of delivering quality patient care is subject to high performance through patient focused teamwork. However, we need to close the gap between traditional practices and the new attitudes required from an effective team to achieve such a great ambition. Therefore, healthcare organizations should aim at providing exceptional patient care by adopting wide team based culture in which certain values and principles are shared and transparently communicated among team members, including patients who should be placed in the heart of the care. And so, therefore, always remember that an effective team has to involve the patient. An effective team involves everyone. An effective team has to be reviewed if they are succeeding. Stay blessed.